You call your insurance plan with coverage questions and contact the plan if you want to change your primary care physician, primary care doctor. Here's an example, as this is just a sample of a card that, as you know, the card looks the same for everyone in the plan, not the care, but the card. Even if they get a tax credit, it's the insurance card. Connector Care plan cards will have Connector Care printed on them. But in this sample, again, you've got the member name, their number, the effective date, the prescription group number, which is what the pharmacy or whoever's doing your medications would need at, your group's number. Here you see here your co-pays for your primary care physician, provider, your specialist co-pay, your emergency room co-pay information, the prescription co-pay, how much for generic, how much for name brand. We talked about the formulary before. Again, I wish my card looked this simple. Here you also have the member services number and then claims and inquiries phone number as well. Again, and it's always important, as you know, I don't have to tell you this, look on both sides of the cards because there's a lot of information on both sides. Right. Don't forget the back might have some very important information too, especially numbers to call. It's amazing how much information they can put on those little cards. So moving on, if consumers come to you, they've got a bill, and again, we've sort of talked about this before, talking about, make sure the doctors or the provider is in network, explaining how bills get paid. Again, it may or may not be understand or common knowledge to some people. Again, I don't mean to beat a dead horse, and I'm all about, I'm not trying to injure a horse here, but confirm your doctor's in network for the consumer, because you don't want to get that sticker shock bill just because their provider, their doctor, or the provider they went to is not covered, is not in network. Network providers bill the health plan directly. Out-of-network providers may not. You may need to do it, so check with the plan for the process involved. So when the consumer gets a bill, review it, and then they might call you, I don't know. But they also need to review the explanation of benefits, which is sent by the plan that lists what services you got, what the cost was, and what the insurance company will pay. And there may or may not be a column that says what you are responsible for. Now, whether you actually pay it or not depends on the plan you have and the provider, as we said earlier. Again, the consumers need to review the coverage, the benefits, and appeal sections of the health plan contract. And with every